Are digestive problems making your life difficult?
Gastrointestinal fistula, or GIF, is an abnormal connection that forms in the digestive system, allowing fluids from the stomach or intestines to leak into other organs or even outside the body through the skin. Simply put, substances that should stay within the digestive tract find a wrong pathway to escape. This condition is very dangerous because it can lead to severe infections, dehydration, malnutrition, and even life-threatening sepsis. GIF most commonly occurs as a complication after abdominal surgeries. Statistics show that approximately 85 to 90% of gastrointestinal fistulas develop following surgical procedures. However, trauma, inflammatory diseases, severe injuries, or erosion of the intestinal wall can also trigger this problem. In some cases, no clear cause is identified, and these are known as spontaneous fistulas. Gastrointestinal fistulas are divided into several types. The first type is an enteric fistula, where fluid passes from one part of the intestine to another. The second type involves leakage from the intestine to another organ, such as the bladder, lungs, or blood vessels. The third type is an external fistula, where intestinal contents drain out through the skin. This is extremely painful and damaging to the skin. The fourth type includes complex fistulas, which affect multiple organs simultaneously and are much harder to treat. The causes of GIF are diverse, but the main ones include abdominal surgeries, knife or gunshot wounds, inflammatory bowel diseases, infections, and chronic medical conditions. In some cases, added pressure on the gastrointestinal system due to pregnancy or obesity can also contribute to the formation of fistulas. The symptoms of a fistula depend on its type. If it is external, there may be fluid discharge through the skin, abdominal pain, fever, elevated white blood cell count, and bowel obstruction. If it is internal, symptoms may include diarrhea, severe infections, dehydration, rectal bleeding, malabsorption of nutrients, and rapid weight loss. The most dangerous complication is sepsis, which occurs when infection enters the bloodstream. Sepsis causes a sudden drop in blood pressure, organ failure, and can be fatal if not treated quickly. Diagnosis involves several methods. Blood tests help evaluate electrolyte balance, nutritional deficiencies, and overall health. Endoscopy allows doctors to directly examine damaged areas of the stomach or intestines. Imaging tests such as barium swallow, barium enema, X-ray, CT scan, and ultrasound are also important to locate and assess the fistula. Treatment of gastrointestinal fistulas depends on their type and severity. Some small fistulas may close on their own within 30 to 50 days, but close medical monitoring is required during this time. Supportive care plays a key role in management. Since normal digestion and nutrient absorption may not function properly, patients are often given intravenous nutritional support. In addition, medications such as proton pump inhibitors, loperamide, or drugs that reduce intestinal secretions are used. If the fistula does not close on its own, or if infection worsens, surgical intervention may be necessary. During surgery, the damaged area is repaired or a special drainage system is placed. In recent years, endoscopic techniques have also become common, where doctors use special sealing materials to close leaking sections without major surgery. The major complications of GIF include sepsis, nutritional deficiencies, and severe infections. Because proteins, vitamins, and minerals are lost in large amounts, the immune system weakens significantly, making patients more vulnerable to other diseases. Prevention is extremely important. After abdominal surgery, patients should be carefully monitored for fluid balance, proper nutrition, and signs of infection. Maintaining a healthy lifestyle, treating inflammatory bowel conditions on time, and undergoing regular medical checkups also reduce the risk of fistula formation. In conclusion, gastrointestinal fistula is a serious medical condition that can become life-threatening if not treated properly. However, with early diagnosis, appropriate treatment, and supportive care, the risks can be significantly reduced. Recognizing symptoms early and seeking medical attention may save a patient's life. Managing this condition requires teamwork between doctors, patients, and caregivers to ensure the best possible outcome.
Did you know when you eat may be more important than what you eat?
Intermittent fasting, or IF, is not a traditional diet but an eating pattern that alternates between periods of eating and fasting. Instead of focusing on what you eat, it focuses on when you eat. The most common style is 16:8, where you fast for 16 hours and eat during an 8-hour window. Other approaches include 5:2 fasting, where you eat normally 5 days a week and restrict calories on 2 days, or alternate day fasting. It has become popular because research suggests it may improve metabolic health, promote fat loss, protect against disease, and even extend lifespan.
What happens inside your body when it runs out of sugar?
When the body enters fasting mode, it gradually depletes its glycogen stores and switches from glucose to fat-derived ketones as the primary fuel source. Scientists call this the metabolic switch. This change triggers molecular and cellular adaptations, reduced insulin levels, improved insulin sensitivity, increased growth hormone, and activation of autophagy, the body's natural process of cleaning out damaged cells. This switch is central to many of the health benefits seen in intermittent fasting.
3. Want to burn stubborn belly fat without counting calories?
Multiple randomized clinical trials and systematic reviews show intermittent fasting can be an effective tool for weight management. People often lose between 0.8% and 13% of their body weight in a matter of weeks to months. Unlike continuous calorie restriction, many individuals find fasting windows easier to maintain because they do not have to count calories constantly. By lowering insulin levels and increasing fat oxidation, it helps target visceral fat, the deep belly fat that increases the risk of diabetes and cardiovascular disease.
Can fasting really improve your blood sugar and prevent diabetes?
Studies show intermittent fasting may lower blood pressure, reduce resting heart rate, and improve cholesterol profiles by lowering triglycerides and LDL cholesterol while maintaining HDL. These improvements can help reduce the risk of heart attack and stroke. However, long-term population studies are mixed. Very narrow eating windows might increase cardiovascular risk, so moderation and medical guidance are important. One of the most exciting benefits of IF is the activation of autophagy. During fasting, cells break down and recycle damaged components, improving efficiency and resilience. Autophagy helps prevent neurodegenerative diseases, reduces inflammation, and promotes longevity. Animal studies show extended fasting triggers deep cellular cleaning, potentially slowing aging. Human evidence is growing, but long-term clinical trials are still needed to fully understand its impact on health span and lifespan.
Did you know fasting can clean out your damaged cells?
Fasting not only affects the body but also the brain. It enhances brain-derived neurotrophic factor, BDNF, supporting learning, memory, and neuroplasticity. Increased ketone production provides steady fuel for the brain, often improving focus and mental clarity. Some studies suggest it could lower the risk of Alzheimer's and Parkinson's by reducing oxidative stress and neural inflammation. It also reduces markers of chronic inflammation, such as CRP and IL-6. It improves gut barrier function and reduces oxidative stress, supporting a more balanced immune response. Researchers are investigating whether fasting may benefit autoimmune conditions or inflammatory bowel disease. Early results are promising, but people with chronic illness should always seek medical advice before starting.
Is there a simple way to slow aging at the cellular level?
Animal studies consistently show IF extends lifespan, likely through autophagy, reduced insulin signaling, and improved metabolic efficiency. In humans, it may slow biological aging by protecting DNA and mitochondria, reducing oxidative damage, and maintaining muscle mass. While we lack multi-decade human studies, if impacts pathways strongly linked to healthy aging. Emerging research also suggests fasting positively reshapes the gut microbiome. Fasting periods allow the gut lining to repair and promote beneficial bacteria growth, improving digestion and nutrient absorption. A healthier gut microbiome helps regulate immunity and mental health via the gut-brain axis.
Can you safely work out while fasting and still build muscle?
Moderate exercise during fasting is safe and may accelerate fat burning. Training in a fasted state increases the body's ability to use fat for fuel. For high-intensity or long workouts, some may feel weak without pre-exercise food. Hydration, listening to your body, and adjusting eating windows around exercise are key. While safe for most healthy adults, it is not suitable for everyone. Children, teenagers, pregnant or breastfeeding women, people with a history of eating disorders, and those with chronic illnesses should avoid fasting unless advised by a doctor. People on medications, especially for diabetes or blood pressure, require medical supervision because fasting can affect drug efficacy. It is a tool, not a one-size-fits-all solution.